disappointed, felt like giving up. Was in distress, but my change has come. And God give I strength to rise again and find my place. He called me friend. The struggle's real and the dirty tough. So many told me I was not enough, but in my God I find my strength. With every breath I sing and say, I will rise, I will rise, I will rise, I will rise. Mount up on eagle's wings, I will rise, I will rise, I will rise.
So there were days when giving up thoughts played my mind, but I won't give up. I gotta get up and fight. Oh God, give me the strength, not letting go. I'm holding on to the end. The righteous fall 7 times, but rise again. Dry bones, you can live again. Lord, I know that you love me. Show me your ways, please go before me. I will
rise, I will rise, I will rise.
Mount up an eagle's wings.
I will rise, I will rise, I will rise, I will rise, I will rise.
Mount up an eagle's wings.
On eagle's wings, I will rise, mount up on eagle's wings, I will rise. My change has come. He called me friend. My season of overflow. My God is saying,
Lord, you renewed my mind. You transformed my life. Lord, the chains are broken, and I will rise.
I will rise.
For me to discover
I will rise.
Mount up an eagle.
Mount up on eagle's wings. I will rise. Hey,
I will rise.
mount up on eagle's wings. I will rise. I will rise. I will rise.
Going to the storm.
I will rise.
Mount up,
I will rise.
mount up an eagle.
Mount up on eagle's wings. I will rise. All right, everybody. Guess what? Happy New Year to you. Happy New Year, everybody. They've been waiting for yeah. All right. It's the renew your strength. Been disappointed, felt like giving up. Was in distress, but my change has come. And God give I strength to rise again. All right, everybody. I hope you can hear us. We're having some real technical difficulties that we're trying to sort out. I see you coming on. I do. I see you coming on, all our friends from near and far. We can see you, Ruben. How you doing, Lionel, Giovanni, brother Andre, Caribbean Christian Gospel. We see you, but we're having so much technical difficulties tonight. It ain't funny. It ain't funny, but we're gonna try to get everything fixed. Our producer is working assiduously to see what he can get done on his end. So if you're hearing me, everybody, happy New Year. It's 2023, and we are thankful to God for a wonderful, 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 wonderful year ahead of us. All right. Yes, I realize you're hearing us, even though I'm not sure. Thank you for commenting. Thank you for letting us know that you're actually hearing. It's so good to be with you. Well, let me get into it because we're having some technical difficulties. So if you see us go out, you know what's going on. I don't know if it's the internet. I don't know. The weather is bad on the outside. My pastor, thank you so much. Thank you so much, LaSalle. Thank you, everybody. The weather is terrible on the outside. And so I'm not sure if that has something to do with our broadcast today. Mr. Handsome, how you doing, Mr. Handsome? Bless you. My brother Hakeem. These are all our radio friends, I'm telling you. Andre Revelation. Let me introduce to you the beautiful, beautiful, wonderful, wonderful doctor. Her name is Dr. Clovette Hessing. She is a consultant gynecologist. She's a specialist when it comes on to women issues. And she's joining us this evening because if you didn't know, um, this month, the month of January, is celebrated as Cervical Cancer Awareness Month. Doctor, welcome. Thank you so much for having me. Listen, it's a pleasure to have you. I'm so sorry for the technical difficulties we're having, but we're going to see how much of the information we can get out. Okay, great. As much as possible. By the way, I haven't seen it in over 18 years. Imagine that. I think we still look young. Let's put it for the viewers to comment. I'm sure they have seen the back then compared to now photos. So we'll get a poll on it. Doctor, cervical cancer. What's that all about? All right, so cervical cancer really is a cancer that affects the cervix, and the cervix is the neck of the womb. All right, so the cervix is that part of the womb, that lowest portion that dilates or opens up to allow a pregnant mother to deliver a baby. All right, so normally in a normal setting, the cervix is closed. But when the woman goes into labor, it has to dilate up to 10 centimeters to allow the baby's head and body to pass through. And then, of course, the natural sequence is that it will close after that, and then we would, woman will go on with her day-to-day activities. But what happens is that there's an area of the cervix that is susceptible to infection by a particular virus that causes cervical cancer. So when we talk about cervix, because I know it might sound like a stupid question, but it's just one of those questions we have to ask. The cervix is only found in women. Let's get that out of the way. Yes, because it's a part of the uterus, it's a part of the womb. And men don't have womb. Normally, no. Right, because not normally. I know I don't have one. I don't know if there's. So when I say normally, I mean in the non-transgender state. What were I talking about? I wasn't. Yeah, you're right. You're right. Yes. So as a physician, I have to be holistic. Yeah, you have to be holistic in your approach. Yes. Sister Pat, how are you? Welcome, Sister Pat. So cervix. I know they're probably, men are also interested to know about cervix because from time to time, they might hear that word, or the wife or the girlfriend might have an issue there, and they want to know what this is all about and what is the cervix for. Now, you may mention earlier that the cervix, is a part of the womb, and it is all intertwined with having babies, and there was a particular virus that causes cervical cancer. Can you elaborate on that? All right, so the virus is called HPV, which is short for human papillomavirus. All right, so once this virus gets introduced into the cervix, the thin layer lining of the cervix, then it causes those cells to just multiply out of control, which is what a cancer is, right? And this virus is typically spread via sexual contact. So so HPV is a virus that is sexually transmitted. Yes. Are you serious? It is. It is serious. It is serious, and because of that, it makes cervical cancer preventable. So when we talk about prevention of cervical cancer, if you're not having sex, you can't have cervical cancer. That's what you're saying. Well, based on what the studies show,
it is not all or none, but definitely the rates are very much more reduced in virgins in terms of transmission of the virus, right? Because the virus does not necessarily require vaginal penetration for transmission. So you don't have to have penetrating intercourse for the virus to be transmitted or for you to pick up the virus. So the virus is really transmitted via skin to skin contact. So any intimate contact, use of sex toys, and so on and so forth can result in the transmission of the virus. It is even shown that some persons who use condoms still have some rate of transmission. Again, because the other areas of skin are being exposed to each other during intimate contact.
I want to say welcome to Pastor Curry and Brother Jerome, Rosalind Williams over there in Pennsylvania, Philadelphia. Welcome, welcome. Thanks for joining in the discussion. For those of you on YouTube and Facebook, thank you so much for joining us. We've been having some technical difficulties, but we're trying to get the information out as much as possible. So if you're just joining us, welcome. We have with us Dr. Clovette Hessing. She's a consultant gynecologist, and also she delivers pregnant mothers. What do you call that one again?
Obstetrician or maternity care.
Thank you very much.
Yes.
That's the same one.
So that's specializing in maternity care, virus pregnancies, deliveries, and after birth, after pregnancy, meaning postpartum care.
Let me ask you, doctor, let's go back to the virus because we're celebrating, we're looking at this month is Cervical Cancer Awareness Month.
Right.
And no, I don't feel that many men do know about cervical cancer because they don't have a cervix. We don't have a cervix, at least for the real men. We don't have a cervix, and so maybe because it has no bearing on us, we're not careful to understand how it affects our wives, how it affects our sisters, how it affects our nieces and our mothers, and you name it, or your girlfriend. All right. However, you mentioned earlier that there are other ways in which this virus can be spread. Can this virus be spread like orally, like through oral sex?
It has been shown, yes, that the HPV virus can be spread via that route as well. Just to backtrack a little bit, just to give you some more background with regards to the HPV virus. So the HPV virus has several strains.
Yeah.
So there are over 100 different strains of the HPV virus itself, with 40 of those affecting the anogenital region, meaning the penis, vagina, anus region, right? With that said, you do have some types which have a propensity to infect the throat, the oropharynx, and can cause oropharyngeal cancers and cancers of the head and neck as well. So, and can cause not only cervical cancer, but also penile cancer, which is cancer of the penis, right? Anal cancer in men and women, which is more prevalent in men in terms of with high-risk sexual behaviors, such as men who have sex with men, and so on and so forth. So cervical cancer can be spread via oral contact.
So let me understand something.
HPV virus, rather.
Let me understand something now, doctor, based on what you just said a while ago. So the virus that causes cervical cancer is called HPV.
Correct.
And this virus can infect men, even though it's a virus to me that was intended for a woman. But
it's
because
not necessarily intended for a woman.
Okay.
It's just a virus, just like how you have coronavirus.
Okay.
Right? In fact, its shape is similar to the coronavirus shape. Most viruses are made up of an envelope and a capsid protein on the outside and the genetic material on the inside. So it is a similar type of setup, but you have different viruses that have a propensity or a tendency to attach to different mucosal surfaces of the body. So the coronavirus, the flu virus, has a propensity for the respiratory tract mucosa. So it will cause problems there. Something like the rotavirus has a propensity for the mucosal lining of the intestine. So it gives you a gastrointestinal manifestation. So the HPV virus has a propensity to cause infection and maladies in the cervix, the anogenital region, meaning the anus, right? As well as the oropharynx, meaning the back of the throat and down into the back of the throat.
You know, you said something that captivated me a while ago, doctor. You said the virus has shapes. That's what you said, right?
Yeah, different organisms have different shapes.
Really?
Yeah. Different organisms have different shapes. So you might have a fungus is a different shape from a bacteria, different shape from a virus, different shape from a amoeba or algae. Or the amoeba or the algae is like the green stuff that tend to build up on the coral in the sea. And so those are different organisms, they're alive, they're living. So, and they have different shapes. When you look at them under the microscope,
Felt like giving up. Was in distress, but my change has come. And God give I strength to rise again and find my place. He called me friend. That's the most real and the dirty tongue.
All right. Welcome back.
My God, I find my strength with every breath I see.
Yes.
But I won't give up, I gotta get up and fight, oh God.
sure you can hear us. If you can you leave a comment? All right, thank you so much for sticking around. I know we're having some bad weather on the outside, so I won't imagine that the technical difficulties and the internet and everything is as a result of that. But we want to get the information to you as much as possible. Thank you so much for sticking around. Doctor, back to the conversation. So we were talking about the virus that causes cervical cancer. Um, let's go into the treatment factors. Is this virus curable?
Okay, so the effects of the HPV virus on the cervix can be detected, and they can be detected before it even goes to full cancer state. And this is detected by the very first, very basic pap smear.
Mhm.
Right? So what the pap smear does, it takes a small sample of cells from the cervix, from that lining there. It's placed on a microscope. We look at it, we send it to the lab. A pathologist reviews the slides and to see if there are any any abnormal changes within the cells in keeping with HPV virus. What's now in vogue is also HPV testing, so we can actually test for the actual virus itself,
Wow.
presence of the
Wow.
of the virus or the virus antibody, right? And so that will be able to give us more information as to whether or not HPV is actually there and what type. Okay, so that's something I wanted to also touch on because you have different types of HPV.
Yeah, go ahead.
You have
Let's hear the types of HPVs that they have.
right. So you have the types that cause the cancer, but you also have types that cause warts, which are some growths that are not cancerous.
Okay.
And
That's
these
what,
growths,
benign?
those are benign.
Benign,
Yes,
okay.
you got that.
Mm-hmm.
Right? So the benign growths can also affect the same regions that the cancer virus can affect. So the same cervix, vagina, penis, anus, um, those are the same areas that the warts can be affected.
But in this situation, this issue is a common issue.
It is quite common, actually. Um, in Jamaica, about 200 women die from cervical cancer each year. So cervical cancer is the second leading cause of cancer in women, right? So what I was getting at was that once we are able to pick up the early changes on the pap smear, then we can intervene. We can do some procedures, which are some of them are even office procedures that can be done to remove the abnormal cells before they go on to full extent of cancer, of cervical cancer.
So are you saying, doctor, that one of the leading way to detect if HPV is present and if a woman is susceptible to cervical cancer is through a pap smear?
Definitely one of the most simple, most cost-effective, most easily done tests. It's not a painful test. I've never had any of my patients complain about the test being painful when I do it, actually. But it's not a painful test. It should not be painful. You may experience some discomfort. And so it is the go-to. And then in addition to that, we do the HPV typing, which increases the sensitivity of the pap smear.
So you would encourage every woman to
Every
ensure,
woman over the age of 21 is what
even if they're not having sex?
Even if they're not, because remember that although your risk is very much reduced, right? If your risk is very much reduced if you're not sexually active, but there are other remember sexual intimate contact that can allow the virus to be passed from person to person, from one person to the next. And I wanted to add with regard
All right. All right, Doc. Welcome back, everybody. As I told you before, the weather here is very bad on my neck of the woods, so we're still trying to get the information out to you as best as we can with the limited opportunity that the internet is giving to us right now. All right, welcome back. Now, we were before we went talking about the vaccine, and you were saying that the HPV vaccine is recommended for children starting at what age?
So it's usually at about age 9. So it's being introduced into the childhood immunization programs.
Yeah.
And the aim is to have them receive this vaccination before they're actually exposed to the HPV virus. So another beautiful thing about the vaccine is that it covers for a couple of the high risk types that cause the cancer, but it also covers for some of the low risk types that cause the warts.
Okay,
Right.
all right. Now, and you said that there are 3 doses.
It's usually 3 doses.
3 doses, and it starts at 9 and end at what age?
So it's based at 0, 3 months, and 6 months. So usually within a year, they would have completed the 3 doses or before the year is out.
Okay.
Yeah.
What are some of the myths about cervical cancer? I remember as a youngster growing up, we were of the impression that women do get cervical cancer because maybe their husband or their spouse penis is very big. And so as a result of the bigness, it scraped the womb and a whole lot of stuff that, we grew up to understand. Is that a myth? Is there any truth to that a humongous penis can cause cervical cancer?
Well, it is a myth. It is a myth. So to debunk that myth, size may matter in other things, but with regards to cervical cancer, it's really the virus. So what happens is that the virus gets introduced into the mucosa. The mucosa is the thinnest layer, outer layer over the tissue, right?
Mm.
So the virus gets introduced into that layer through what we call micro abrasions, which are just microscopic tears, right? So you may have had sexual intercourse or whatever, and then they are using of the sex toys or whatever, and it causes some tears that can you don't see a cut there, but there's some bruising, and the virus gets introduced into that area, and that's how the virus gets its
Yeah. So there we go again. So doctor, this is a very interesting topic, and I want to get the information out to our folks. I mean, you're giving us so much great information, and we want to continue the discussion. But because of the internet issues that we're now having, we're going to break for today, and we're going to see what we can do for another day, and we're going to have you on. In fact, we should have had Dr. Carla Dunbar, but she's having the same issue like
Okay.
we're having right now, the internet issue. So I don't know if it's a global thing right now or it's just that the powers that may be don't want the information to get out there. But we will find other means and ways to get this information out. So if you are online, thank you so much for joining us. Auntie Dottie, Vivian, Jarrett, everybody who came on from the start of the show. And you stick it out with us even when we were going in, out, and all over the place. And you stayed with us. Thank you for staying with us. Doctor, thank you so much. It's been a pleasure.
Thank you so much for having me.
And as I said, we're going to do this again.
Definitely.
We're going to get everything fixed, and we're going to do this again. And because there's so much to learn about cervical cancer, and I'm very interested in this topic because I have a daughter, I have a wife, and I have sisters, and I want nieces, and I want to know. So if these things should ever come our way, at least we have the basic information and know what to do and how to
Definitely.
approach it. Thank you so much. Thank you so much, everybody. Thank you. We will do this again. Lisa Brooks, you came on when we were hopping off. Thank you, thank you, thank you. We are going to continue looking at cervical cancer. It is Cervical Cancer Awareness Month. And with me was Dr. Clovette Hessing, and she is a consultant gynecologist. All right. Thank you, guys. Thank you for staying on. Thank you, QB. Thank you. Thank you, everybody. Until next time, walk good. God bless you. I may say, whoa, Lord, ow, ow, ow. I may say, whoa, Lord, ow, ow, ow. Why? Why? Lord have mercy. I stumble through the aisles, yeah, with tears in my eyes. I know my storm's not over, but my battles will be won. I've been this place before, yeah. This is my threshing floor. My shame may be battered, but I know my anchor holds. Yeah, getting weary, journey so long, but I'ma hold on. I'ma hold strong. Use my faith to move the mountain. Pray till something happens. I am not leaving till you bless me, Lord. I am not leaving till you bless me, Lord. I'm after your heart, not your hands, Lord. I'm available for your blood. You can use me for your glory. Here to tell your story, even though I'm not worthy of now. Anywhere that you send me, I go. From the hills into the valleys, from the churches to the street, me I go to it. But I'm getting weary, journey so long. I'ma hold on, I'ma hold strong. Use my faith and move a mountain. Pray till something happens. I am not leaving till you bless me, Lord. I am not leaving till you bless me, Lord. If you don't send me, I won't go. Where you lead, Lord, I'll follow. On my knees, that's where I go. For my open doors. Won't let go till you bless me like Jacob. I'm desperate, Lord, please fix my focus. When trials of life overtake us, you never say. I am not leaving till you bless me, Lord. I am not leaving till you bless me, Lord. I am not leaving till you bless me, Lord. I am not leaving till you bless me, Lord. I stumble through the aisles, yeah, with tears in my eyes. I know my storm's not over, but my battles will be won. I've been this place before, yeah. This is my threshing floor. My shame may be battered, but I know my anchor holds. Getting weary, journey so hold on, I'ma hold strong. Use my faith to move the mountain. Pray till something happens. I am not leaving.